Hi, I'm John Cobelt, and I'm at Saddleback Eye Center to get the LASIK Insights with Dr. Manger. Hi, Dr. Manger.
Hi, John. Always good to see you.
Now, as you know, LASIK helped me go from a vision of 21,000 to seeing 2015. I spent my whole life wearing big, thick glasses since I was in grade school. And now LASIK gave me freedom from glasses, and I'm able to see clearly with my own eyes. For me, this has been a miracle. Before I had LASIK, I had a lot of concerns, a lot of fears, because I didn't have all the information. And I think the insight that would be really helpful is for us to focus on the top 5 LASIK myths.
That's true. That's a good place to start. One key to seeing clearly and getting things done right is understanding the process before you enter into it.
Now, let's start from number 5. Number 5 myth, I was told I'm not a candidate for LASIK.
Yes, that's something that we hear frequently. Many eye care professionals tell people that they're not candidates for LASIK because they're nearsighted, they're farsighted, they have astigmatism, or they need reading glasses. Now, I myself have specialized in farsightedness, astigmatism, and reading glasses for the past 17 years. And I performed LASIK surgery on my wife, who needed reading glasses before I did the surgery. I did LASIK surgery on my son, who was extreme amount of farsightedness. So those things we've been able to handle very nicely for many years. And even at that, we actually do turn away 20% of the patients that come in here for LASIK surgery because of various eye conditions such as cataracts or keratoconus, for instance.
So why is this myth perpetuated?
Well, the doctors want to keep you as a patient for routine eye exams, for eyeglasses, for contact lenses, or maybe the doctor just isn't up to speed with the latest technology. Also, what enters in is the advice from well-meaning family members and friends who may not be completely well-informed even though they've had LASIK surgery.
So the number 4 myth is I need to research the technology more before I have LASIK.
Well, LASIK technology is very complicated and difficult to understand, even for anybody other than the LASIK surgeon. And the reality is that the Allegretto laser and the Vuzix laser are used in over 90% of the LASIK surgeries done in the United States every year. Both of them are cutting-edge technology. They both give excellent results. And the vision result that you're going to get from your LASIK surgery depends mainly on the experience, the judgment, the attention to detail of your LASIK surgeon.
Now, the number 3 myth, I can price shop for LASIK like I would for a car or a piece of furniture.
Well, that's the bottom line on that is LASIK is not a commodity. It's a surgery where the outcome is going to be different according to what surgeon you see. And the main reason for that is that there are 20 or 30 decisions which need to be made in every single LASIK surgery eye, and every surgeon is going to make slightly different decisions on these various processes, and that's going to affect the outcome of your surgery. Most interesting, in 2006, Congress did a review of the LASIK surgery industry, and one of the things they looked at very closely was the feeding frenzy on LASIK advertising and $3,000 for 2 eyes or less. And they found that people that go to those centers, approximately 1 out of every 6 of them are not happy with their vision. And that's really an unacceptable number. We have an optometrist in our office who did work at a budget center for 3 years. And that optometrist told us that they feel that it's more like 1 in every 4 patients are not happy with their visual result from a budget center.
You wouldn't shop around for the cheapest brain surgeon, so why would you shop around for the cheapest LASIK surgeon?
Well, that's true. 80% of the sensory input to the human brain comes from the eyes, and so the obvious conclusion there is you better do it right the first time. You want to avoid the possibility of complications. You want to avoid the need for further LASIK surgery.
Now, myth number 2, it doesn't matter where I go, it's all in the laser. And before Dr. Manger talks about that myth, let me tell you, I went to a number of other surgeons before I approached Dr. Manger, and the first guy laughed at me. And the second and third guy talked about doing it, but they didn't seem to have the right number of tests. They didn't project the confidence. They didn't seem absolutely sure everything would work out. And when I came to Dr. Manger's office and I found out they do 14 separate tests and the sophistication of their laser technique, I realized I was in an entirely different ballpark here.
Well, if that were true, it wouldn't matter what surgeon you went to, you'd be getting the same results, and that it just doesn't happen that way. That an expert said a long time ago that LASIK is 90% surgeon and 10% technology. The surgeon has 35 pages of data that's printed out from the laser, and each surgeon has to analyze it in their own way with their experience and expertise to give you the best vision possible.
Here we go, the number one LASIK myth. The LASIK technology is still undergoing improvements, so I should wait a few more years.
All the major advances in LASIK technology that have taken place over the last 10 years, which include the intralase laser to take the place of the keratome and the metal blade, the wavefront technology with the custom view, and the tracker, are very significant, and we don't have anything major on the horizon that we're expecting. Any improvements from this point forward are what we call incremental or very small, and there's no real need to wait. 99.7% of our patients are seeing 20/20 or better, and by the way, the other 0.3% are seeing 20/30. So the bottom line on that is nobody is going blind from LASIK surgery done at Saddleback Eye Center. It hasn't happened before, and it's not going to happen in the future. The overwhelming majority of our patients are actually seeing better than 20/20.
Trust me, you don't want to wait for vision as clear as this. In fact, you'll be wishing you did it a lot sooner. So this has been the top 5 LASIK myths with Dr. Charles Manger.